Good afternoon and a really warm welcome to everybody. My name's Anna Nicholson. I'm the president of the of the Public Health Association of Australia, Victoria branch. And with me is David Tao, co-president of the Australian Health Promotion Association for Vic and Tasmania branch. We're really pleased to be here with you this afternoon to talk you through our state election campaign. It is a very wet and soggy afternoon. We hope that you're safe and well wherever you are. I am calling in from Dja Dja Wurrung country in central Victoria, where there is some significant flooding going on, but safe and well at this end. I'd like to kick off by acknowledging the traditional owners of the lands on which we're meeting today and pay my respect to elders past, present and emerging, and also any Aboriginal or Torres Strait Islander people who are here with us this afternoon. We're going to give you a bit of a run through some activity that we've been busy with over the past weeks and months, actually, that was kicked off by the Public Health Association last year. And we've recently partnered with AHPA to really give this activity a big boost and to really amplify it in the lead up to the election and co-host this activity. So we're really excited to share with you what we've been up to. So our own committee in Victoria, the PHAA committee, was reflecting as we were starting to look toward the state election about, I guess, a conversation that is very much dominated by the public health system in the sense of hospitals and expenditure in, this confusion between public health being about public hospitals. So we're talking about how can we shift this narrative and really help people to understand what primary prevention is all about. So we started work on a report that celebrates 10 successes in public health in Victoria. And we launched this report at Parliament House in August. And it's really been an incredibly useful tool to help to highlight the great successes that Victorians have been able to achieve in tackling some really complex challenges. This report is available for use, and we hope that it will be useful for members in your own advocacy activity or research or however you might like to use it to assist with these conversations. I'm going to share with you, this is a few pictures from the launch we had at Parliament House on the 4th of August. I'm really keen to share with you,
when public health,
not Terry, we're going to flick through that, but
when public health fails, we put pressure on our public hospital system. 1 in 4 of the people who are admitted to hospital today in Victoria, that hospital admission could have been prevented if we got public health right. So the challenge to fund our public hospital system will never stop. We can dial that pressure back by getting public health right.
So that's a message that we're all really familiar with here in PHAA and AHPA, and it's a message we'll be really prosecuting strongly in the coming weeks. I'm keen to share with you a couple of other brief videos from the launch event because it highlights, I guess, the bipartisan support that we can achieve in public health and that we've been working toward over the past several weeks in meeting with members of Parliament to really raise the profile of some of these really important public health issues. The first speaker at our launch event was John Thwaites, and I'll play you a short clip from that now.
I'd like to really congratulate you on this great report, and I think what it shows is how Victoria has been a leader on public health over many decades, but it also demonstrates that we need to maintain that leadership with big challenges going forward, like how we prevent harm from climate change and how we work with the community on climate action.
Play another short clip as well from Ted Baillieu, former Premier of Victoria, who had a really similar message about the importance of bipartisan support.
I am very interested in public health myself, and I'm very interested in the bipartisan nature and importance of bipartisanship in public health. We can make a huge difference. We can't have this gathering without acknowledging we've been through the most extraordinary times in the last 3 years. The pandemic is arguably not over, but I think it's absolutely vital that we learn for the future because there will be more. And if you look at the vaccination...
Thank you. So really terrific event. We also had a video address from Nicola Roxon, Chair of the Vic Health Board. Vic Health had very generously sponsored the development of the Top 10 report. We'll share a link to that report in the chat so that you can refer to it and use it as useful over the next coming weeks and months and years, we hope.
I am very interested in public health myself, and I'm
sorry about that.
I'd like to really congratulate.
There we go. So I'm going to now move to our state election asks. So this is a platform that we've put together that addresses some of the key areas that were profiled as areas of future need within our top 10 report. We've also been working really closely with some of our peaks and allies to make sure that we're asking for similar things, that we're singing from the same song sheet and really addressing these areas of greatest need and opportunity. The first one, I'm sure, is no surprise to anyone who's joining us this evening, and it's about, exactly as you heard from Terry, this need for increased investment in prevention and increasing the proportion of the health budget, increasing the proportion of government expenditure to 5% of the health budget. At the moment, it's about 2%, and it's not changed in recent years. And in contrast, we've seen overall expenditure on health tracking up at about 4% per year. In WA, when they did a review of this, they came to the conclusion that that's just not sustainable, and they implemented this commitment to reaching 5% for prevention. So there is precedent there from other states, and certainly we've been prosecuting that argument. This is something we can be working toward. You'll also be familiar with this as a key commitment in the National Preventive Health Strategy to achieve 5% expenditure on prevention by the year 2030. This is something we know is essential in order to take the pressure off the health system and our health workers, and more importantly, to prevent the 38% of illnesses, disease and early deaths that we know can be prevented, that unfairly impacts as well on those Victorians who are most in need. So this is our first ask in the election platform. The second one relates to our local public health units. You might be familiar with these units. They were stood up during the pandemic, and really with an initial focus on COVID-19 contact testing and tracing. The remit was expanded in the most recent budget to include functions more broadly for communicable disease, but also chronic disease. However, the funding is due to expire on the 30th of June next year for that expanded remit. We think these decentralised local public health units can play a really critical role in delivering locally tailored, coordinated health responses that reach all Victorians no matter where they live. Really critical infrastructure to deliver our health promotion, prevention and protection activities. So we're calling this election platform for $150 million per annum for the next 5 years to really enable these public health units to be equipped and attract the workforce that they need. At the moment, they're just hamstrung in having that really short-term commitment, short-term funding commitment. Our next ask relates to, sorry, it's slow to go. Our next ask relates to public health, development of a public health officer training program. So that's really all about ensuring that we've got a skilled workforce to meet our needs into the future. So we know, the the COVID-19 pandemic has really exposed some weaknesses in the Victorian public health system. There was an insufficient number of adequately skilled public health leaders and a broader surge workforce. We did used to have a public health officer training program that was disbanded some years back, and we see that this is a really key gap. We need a system like this so that we can, have a system that gives us this pipeline of ready trained professionals into the future. To achieve that, we're calling for $7 million commitment per annum to establish a 3-year training program. That would give an intake of at least 10, both medical and non-medical trained staff to participate in this 3-year program. that will really help to address the current public health workforce shortage in Victoria. Our next ask relates to, similar to the broad ask of 5% for prevention, a separate one of dedicated funding for mental health expenditure on prevention and health promotion, again by the year 2030. This has really arisen out of the Royal Commission, which called for some dedicated funding for mental health prevention and health promotion activities. We know that it was found in the Royal Commission that about 1% currently of mental health expenditure goes to prevention and health promotion. And there's really need to protect funding to tackle the root causes of mental illness, and to keep our community mentally healthy. There's been some great functions, great reform agenda in the past, year or two since the Royal Commission findings. But so far, the bulk of budget commitments have really been on the treatment end. So this dedicated funding will really help to shift that and give Victorians the best possible chance of being mentally healthy and well into the future. The recently established Mental Health Promotion Office is really well placed to then help direct expenditure on these activities. Our next ask is really a principled one, and it's about supporting the self-determination of Aboriginal community-controlled health organisations. This is an ask that the Victorian Aboriginal Community Controlled Health Organisation, VACCHO, has put forward and is collaborating as well with VCOS, Victorian Community. Sorry, I'm going to just skip past my acronyms. It's really about ensuring that Aboriginal and Torres Strait Islander people have the right to culturally safe and effective healthcare. And it's ensuring, recognising the capability of the community-controlled health sector to deliver this care, to recognise and determine how to best meet community needs and priorities. This also really needs to be backed by an ongoing fund for AHPAs to build and maintain healthcare facilities so that they're equipped to deliver high-quality healthcare services to meet the needs of Aboriginal and Torres Strait Islander Victorians. We also know there's a really strong return on investment case for this, with a strong cost-benefit argument, and good evidence that the lifetime health impact of interventions delivered by AHPAs is 50% greater than mainstream health services. So some really good arguments for that as well. Our final ask relates to the establishment of a Victorian Sustainability Health Unit. This is all about tackling climate and health. We know this is a really big and interconnected problem, but we also know that there's some good activity already going on here. The Health and Human Services Climate Change Adaptation and Action Plan outlines some really good actions, but it needs a central coordinating function and budget. This sort of health sustainability unit will enable us to tackle, in particular, reducing the climate footprint of the healthcare sector. We know that it contributes about 7% to the overall carbon emissions, which is huge. There's much more we can be doing in that space. A health sustainability unit would also play a really critical role in coordinating local actions and also increasing awareness about the health impacts of climate change. There is a similar sustainability unit in Western Australia and also in New South Wales, and there's really great evidence from the United Kingdom about the effectiveness of units just like this, both for reduction in greenhouse gas emissions and also for cost savings. I'm going to pass over now to David to talk you through how you can get involved in amplifying these messages.
Thank you, Anna, and thank you everyone for joining us. Can I also acknowledge the traditional owners of the land where we are all joining from today. I am on Wurundjeri Woiwurrung country, and I pay my respects to their elders, past, present and future. Really grateful to be able to work with the Public Health Association on this really important work, and we're grateful of your time and coming to this afternoon to hear about it. So you've heard about the components of the campaign, and as Anna says, what are some of the ways that you can join with us in amplifying those messages and getting it out there so that people hear it. We'll step through it in a bit more detail, but we have some resources to assist you in doing that, primarily through a advocacy toolkit. I'll flick on to the next slide. Cheers. So the toolkit is available online, and components of the toolkit are broken down as well. We're also really keen that you use the hashtag that is there, Vote for Public Health. That is a hashtag which we are seeing used not just in Victoria, but throughout public health voting campaigns. And we're really, that's a great way to connect the work that we are doing here in Victoria, but also to connect it to future programs as well, and to amplify that message. So we look for those opportunities as well. If we flick through. So how can you get involved? We've got 3 key steps for you. The first one relates to social media and the power of social media advocacy. I think we all know the opportunities there. So be it Twitter or Facebook or LinkedIn, there are great ways to get social and share the campaign messages that we have on social media. There are still some more traditional methods of advocacy which are really impactful also. We would love it if you would be able to write to parties and candidates or send them an email. And we're certainly seeing more and more candidates out there on the street and probably wearing their gumboots today, but there's the opportunity for you to speak with candidates and share our campaign messages and ask them whether they will commit to those campaign messages. Finally, there is the chance to get out and vote. We are in the process of developing an election scorecard to help you through that, and so that you are informed on which of the parties are aligned to our campaign asks. And of course, the importance of equity, ensuring that other people who you work with and people who you know have the ability and the resources to be able to get out there and vote themselves. So we have some templates, and what I would say is that online at the moment there are a few templates there, but we hope that they will increase over time, and we'll update them as the campaign progresses as well. There is a template letter which you can use to write to a candidate. We would encourage you to follow some of the tips within our advocacy toolkit to write your own letter, because that can often be more impactful, but there's something there that will give you an idea of the sort of messages that you might use. We've got a range of social media tiles that are available for you to download, and we'll be updating them further over the coming weeks. And within the campaign toolkit, there are already some example tweets, and we'll continue extending those as we get more details from the parties and as the campaign progresses. There's a number of resources there as well. This is designed to be a pretty self-directed toolkit for you. So there are some tips for successful advocacy. There are contact details for ministers and spokespeople from all of the parties. We've included some words of warning. If you haven't been involved in political advocacy before, there's some information there to help you out. And finally, there's some detail there so that you can support other people to access voting as well. As I mentioned before, PHAA and AHPA are working to establish an election scorecard. We are non-partisan and non-governmental organisations, but we are approaching all of the political parties and asking them how their policy positions align to our election asks, and we will publish an election scorecard based on the key that's present there, but that will be available probably by mid-November. We have reached out to parties already. It'll take us some time to get the responses back and chase them up if they haven't got back to us, but we will get that information out, and we will let you know via our social media accounts and contact with our members when that information is available for you, so that you can be informed on election day, and so that you can encourage your friends and colleagues and loved ones in the ways that you think that they might be able to vote as well. So to access those resources, and we've already dropped this information in the chat, there is a campaign page. We would suggest using the bit.ly link that is there, because that will ensure that you can always access the information no matter if that changes. You can connect with PHAA or AHPA on social media. Those are our Twitter handles, but there is more detail within the election toolkit. So the advocacy toolkit about other ways in which you can connect with our organisations, and by following the campaign hashtag, you'll be able to see what other people are saying about it as well. So we've got some space now for you to ask any questions that you might have for us. The team who are working busily behind the scenes will share that with us.
Should also say we've recently been in touch with our friends at the Australian Epidemiological Association, who are also really keen to be co-branding and amplifying these messages. So that's great. We're really increasing that kind of alliance and the strength in how we're working together on these asks. So we've got one question there. Is it likely when we send the emails to candidates we would get a response, or is that unlikely? What might you expect?
Look, I think that's quite dependent on the candidate, but candidates are definitely keen to get their name out there and be seen as being responsive. So we would encourage you to contact both local candidates and ask them questions, because it will prompt them to speak to the spokespeople and the policy people within their parties. And we would also encourage you to reach out to the parties themselves through the spokespeople who are listed within the toolkit.
We've also got just a request there to copy and to provide the link to the toolkit. I think that was just a little bit hard to access off the slide itself. So I'll just handball that one to the PHAA team. If you could chuck that in there, that would be excellent. Thank you.
So the toolkit is available to be linked straight off the, it's on the page, and you should just, if you click the link, it should just download. We are also, because this is a webinar, we're recording this session as well. So if you weren't here for the beginning, you'll be able to get all of the information if you missed anything at the start.
I can see the link to the campaign pages in the chat, so that's where the toolkit will be housed, as well as those social media tiles and the other bits and pieces you might like to grab and refer to in that central place. We've got another question here. I am a new graduate Master of Public Health Advanced, would be a public health promotion officer, and want some advice on how. I think that question might still be being finalised. Might be on how to get involved. I think the toolkit has a really good selection of activities. And I guess I just encourage everyone to do what you feel most comfortable, the ways you feel most comfortable engaging, whether that be taking to social media or writing letters or approaching an MP, you know, in a place that they might be meeting people in the public. Always a great way to have a direct conversation as well.
And if you've got questions specifically related to health promotion practice in Victoria, I'll drop the email address for the Health Promotion Association in the chat, and you can send us an email.
Great idea. As a plug for both AHPA and PHAA, we do a lot of really great stuff at a branch level. It's an excellent way to meet some like-minded people and to quiz other people in the space on what they know, what they're working on, and how to get more involved. So I really encourage you to get involved in your local branch, whether that be AHPA or PHAA. We do a lot of great stuff together as well.
One of the things we are currently planning is a student careers night, which is in the planning stages, and we should be releasing more details about that within the next few days, but it will be in early November.
Right, we've got another question here. Will Vic Health, Cancer Council Vic, National Heart Foundation be actively advocating this election platform to maximise the alignment of asks? That is a great question. We have been aligning asks with groups wherever possible. It's often not the entire platform, but it might be one or two of the asks contained within. We don't have that particular alliance forming for this ask. Vic Health, I know, are less of the public advocacy body, but certainly do a lot in this space and really supportive of that 5% for prevention. And certainly we have signed on for some other campaigns, including Cancer Council Victoria's Food Fight campaign, and Healthy Futures commitment to 100% renewable energies by 2030 as well. So there are also, and also the Raise the Age campaign. So there are other campaigns that are happening that we will be putting our badge to that aren't necessarily featured within our election advocacy document.
I think as professional associations as well, we often have the opportunity to speak on behalf of the sector, which might be a little bit harder for some of the peak bodies who are receiving direct government funding. And in the case of agencies like Vic Health, where they're not able to participate in advocacy in the same way that perhaps an organisation like ours can.
Similarly, having good conversations with our public health physicians, AHPA, and the Australian College of Emergency Medicine as well, who are really keen to support those asks around an increased focus on investment in prevention, really recognising the critical role of that to reduce the pressure on the emergency system. So it may not be a logo on an advocacy platform, but all sending that same message in whatever ways we're able to within our professional organisations and associations. That coordinated activity is absolutely occurring on that particular ask. No other questions just yet, I don't think. Behind the scenes, we've had some really terrific meetings with MPs. With the Health Minister, we're meeting with the Shadow Minister for Health next week, Georgie Crozier, with health spokespeople for other more minor parties and other independents as well, and really just asking issues of most importance to those MPs and really raising the profile of public health, primary prevention, and the priorities we've outlined in the election campaign.
And there was a piece of media by Croaky, which was produced and published 2 weeks ago, I think now, which interviewed a number of people in public health in Victoria, including myself and Anna, around what we were hoping to see in the Victorian state election, and it was really great to see the consistent messages coming from people across the public health professions and from public health organisations in Victoria in advance, and asking for more prevention and asking for, coordinated activity.
Well, if no other questions, we're right in the half hour, so I'm glad we haven't kept you too long at the end of a work day and on a really soggy wet day. I hope you don't, it's a safe trip home for you. Oh, we do have one more question. Sorry, we can sneak that in. Was the recommendation for a Vic public health training program based on a review of the evidence of the contribution of the past incarnation of this program to public health performance? In part, yes. Also looking at what's worked in other states. There's a very good training program in New South Wales. We've also looked at, there's been some great work done on quantities of particularly medical officers, public health medical officers required. I think in Vic we have 2 funded compared to New South Wales where they have 20 funded per year. So there's huge discrepancies. So really just highlighting those discrepancies and looking at models of what's worked elsewhere interstate and also previously within Victoria as well.
And there is a current piece of work that Vic Health is leading, looking at what that means for the public health workforce, and particularly how this relates to local public health units. And so it's there is already work underway, but it's certainly something that we would really like to see a commitment from government about, so that we're not in a similar situation than we were at the start of the COVID-19 pandemic.
All right, well, we are bang on 5:30. Thank you very much for joining us. Thank you also for sticking through those tech issues with the videos. As we said, I hope that you're safe and well this evening. We're really looking forward to hearing more from you. So you've got those email addresses if you'd like to get more involved or have any questions. Otherwise, we really look forward to seeing all of that activity on the socials and out and about in whatever way feels best for you. I think there's this great opportunity here. We're really excited to have you helping us to amplify these messages.
Thank you so much for your time.